vision. Improving life today. Inspiring progress tomorrow.
Since 1920, when the clinic was founded, Lexington Clinic has stood for some of the first in healthcare throughout central and eastern Kentucky, providing the first radiologist, the first pathologist, the first kidney dialysis center, the first gastroscope, the first in many areas. So as part of our mission and our goal as a clinic, we continue to always look to provide those needs and services that are state-of-the-art to our patients, and that's always been a part of our mission.
Sleep apnea is a difficult condition to treat surgically. It's quite complicated. My background is and training is that for oral surgery and ear, nose, and throat. Accordingly, patients that are seen by myself are able to benefit from the training and expertise in each of these two areas.
Bob Rose was sick and tired of feeling sick and tired. Overweight and suffering from headaches and fatigue, he knew he had to get to the root of his problem.
I was having a hard time sleeping. I'd wake up choking at night. My wife said I'd kick my legs all the time. I had frequent headaches, almost daily. They diagnosed me with a severe case of sleep apnea. They were afraid that I would fall asleep in front of a TV and wouldn't wake up. They said I had such a severe case.
Bob is not alone. According to the National Commission on Sleep Disorders, 1 in 6 Americans suffer from some degree of sleep apnea. Obstructive sleep apnea is a serious health condition that, when left untreated, can greatly impact your overall health.
Obstructive sleep apnea is repetitive blockage to breathing during the course of sleeping. This is very harmful in terms of the response from the nervous system that interferes with the quality of sleep. Untreated obstructive sleep apnea commonly is associated with and then leads to high blood pressure, diabetes, heart disease, including heart attack, congestive heart failure, as well as stroke. Behavioral issues include performance problems, lack of concentration, falling asleep in situations that one might not want to fall asleep, such as while driving or on repetitive work situations like in a factory.
Bob was sent to have a sleep study where his every breath and move could be measured and his sleep patterns observed.
A sleep study measures multiple features of the physiology during the course of sleep. These include brain waves, eye movement, extremity movement, chest movement, breathing pattern, heart rate, oximetry, oxygen level in the blood. By far and away, the most common diagnosis from sleep lab is obstructive sleep apnea.
Patients should know all options before beginning any treatment for obstructive sleep apnea. If it cannot be managed with a CPAP machine or jaw advancement appliances, surgery is then recommended to clear the airway so the patient can breathe easy.
Every patient that's diagnosed with sleep apnea need not fit into a single treatment mode. For example, CPAP therapy is not for every patient. Some patients can't tolerate it, for example, if they gulp air, and those patients readily become candidates for sleep apnea surgery. Typically, patients that have failed conservative non-surgical treatment become candidates for surgery. In my hands, with the background that I have, both with oral surgery and ear, nose, and throat, I'm able to use techniques from each specialty. The basic concept for treatment is really simple enough, which is to advance soft tissue, sometimes using the bone as the handle to pull forward the soft tissue, sometimes removal of tissues such as tonsillectomy. The success rates for surgery for sleep apnea are generally quite good. In fact, medical studies show that they're exactly comparable to CPAP therapy. Indeed, close to 90% of patients resolve their sleep apnea.
I went to see Dr. Collin in December of last year. He went through and cleaned out my sinuses. He cut the tissue in the back part of my throat, and he drilled a hole in the front of my chin, cut the tendon and pulled it forward and re-welded it. And he explained all the procedures very well to me and told me the chances of it being successful were about 40%. Since then, it's unbelievable how much better I feel. I've lost in the neighborhood of 45 pounds since the surgery. And I have so much more energy. The headaches have gone away. I used to snore loudly, and I don't snore anymore. My wife sleeps better because of this, because I used to wake her up kicking and snoring. It's helped the whole quality of my life and my family's life.
Lexington Clinic, helping you rest easier and putting your sleep problems to bed.
The feedback that I see almost on a daily basis from patients that have undergone surgery are by and large quite good, showing resolution of daytime sleepiness, improved job performance. Frequently patients come to the office saying that they can't stay awake to drive, and of course that's nice to hear that that resolves after surgery. In addition, frequently medical problems such as high blood pressure are much easier to control.
I know we bring wonderful care to our patients. It's extraordinarily gratifying to then receive that feedback from the patients that all the things we put in place work properly with good people giving great care. Dr. Collin and his surgery is a wonderful example of this for the type of procedures and expertise that he brings to our patients.
I was feeling tired a lot. I was having trouble staying awake during the day, and I stopped breathing to the point where I had to jump out of bed and started to gasp in order to get air. Dr. Collin recommended the first procedure for oral surgery. We went through that procedure, and he informed me at that time that it was not a 100% guarantee that it may require a second procedure. And about a year later, we went through the second procedure, and that cured my sleep apnea. I feel great, I sleep great, I sleep sound, I wake up, I feel good when I wake up. I have a better thought pattern, I have a better thought process, I'm not tired. I don't worry about driving my family down the highway and falling asleep. So it's been a remarkable experience.
Dr. Collin explained it all very well before the procedure, so I knew exactly what I was getting into and what my chances were. And I have no side effects. On my days off, when I was home, I was taking 2- and 4-hour naps during the day. And now I don't even take naps during the day. It's amazing how much better I feel. It's almost like finding the fountain of youth. I just have so much more energy, feel so much better, have more time for my kids. So, you know, when I work out of town all the time and travel, I don't get to see them as often, and I'm not taking those afternoon naps. I've got more time to spend with my kids, so that's the greatest benefit to this surgery.
Healthcare is a team effort. You can't do everything by yourself. Even if you're a superb surgeon, a superb clinician, you've got to have around you the staff, the ancillary services, the office people, all the other folks that you need to help make that part of the team. It's extraordinarily gratifying for me personally to be a member of that team and to bring that together to take care of our patients.
The most enjoyable part of my role as a surgeon and physician is treating patients with sleep apnea. And that's because we can take people, salvage people who are really in pretty desperate positions, falling asleep, failing interpersonally, and having multiple medical problems, and largely resolve their condition.